thank you for being with us.
Thank you.
Your book, Redefining Healthcare, of which you're the co-author, and then you're also the professor of innovation at the Darden School of Business at the University of Virginia. And actually, you have some revolutionary things that you've been saying here at the health conference, the Alumni Health Conference in Basel. Overall reform in healthcare, not just the US, which is probably at the center right now of a lot of people's attention, but just in general. Broad question, but overall healthcare reform, what would you do if you were in charge?
The U.S. is a little bit behind because we don't have universal access, but overall the big issue is driving improvement in value for patients. And so the big question is how to restructure things so that care addresses solutions for patients. And one of the biggest areas where that's lacking is in the area of chronic disease. In the U.S., chronic disease accounts for 65 to 80% of costs of health care, and yet our systems tend to be structured around acute care. And in no other sector of the economy would you allow that strategic mismatch between the structure of the services and the needs or the expenses.
In other words, it's probably the system's more set up to treat you if you have a heart attack than if you have diabetes.
Yes, but untreated diabetes, you may well end up with a heart attack. It's just that that's a bad outcome and an expensive outcome. It would be better to move care earlier in the cycle for those chronic diseases and prevent the bad outcomes.
How do you do that in the US, where something like 47 million people don't have coverage and probably can't afford to go see a doctor?
Okay, so there are two issues there that we could address, both of which are good ones. One is, how do you make the change happen? And there we have projects working with employers who can, for their communities, help to restructure the way care is delivered and the timing at which care is delivered. And there is some significant work going on in trying to create healthier communities that we can talk about. And then the other question about dealing with the uninsured, the fact that we have so many people uninsured in the U.S. drives costs up because the universal access that exists is to emergency room care, which is late-stage care that's relatively ineffective and inefficient. It's not that the emergency room docs don't do a good job. They do a great job. But care delivered at late stage of disease is inherently less effective and less efficient than care delivered. Yeah, than care delivered earlier. Mm-hmm.
I'm always a little bit surprised when I see how much is spent per capita in the U.S. on health care and how low the result is.
Yeah, the per capita health care costs in the U.S. are extraordinarily high, largely because of this lack of access to early stage and preventive care, which drives way up the costs of treating chronic disease. The costs of treating chronic disease in the U.S. are 3 times higher than in Europe. When you look around Europe, there's a wide variety of ways of achieving universal coverage. There's systems that have socialized medicine. There's systems where the doctors are privately employed. Some countries have have employer involvement. Some don't. There are countries that have both public and private systems side by side. There's a huge array of solutions for universal coverage. It's not how the payment occurs, it's that universal coverage exists because it creates access to early stage and preventive care that otherwise doesn't exist. And I think that's part of what's not understood in the US, is that the question is about care delivery, not just about payment.
What do you think will ultimately be, looking into a crystal ball, and we won't hold you to it a year from now, but what do you think might happen? It looks as though it's going to be insurance reform rather than delivery reform.
Yes, exactly. President Obama has said it directly that this reform will be insurance reform. And insurance reform is quite different than healthcare delivery reform. We need expanded access in the U.S. I hope we'll get universal access. It's not clear yet. But we need expanded access because for both equity and efficiency, you need everyone in the system.
Why is that such a hard concept to understand? I mean, there seems to be this, we don't want the government handling health care in the U.S. Of course, Europeans don't understand that. And if you look at Medicare, it seems to be perfectly efficient. Well, maybe not perfectly.
Not sure what's perfectly efficient, but the whole question of whether the government should run healthcare is actually kind of a spurious question. That this is a question of, the real question is, will we subsidize care for people who can't afford it? And it needs to happen because, first for equity, and then also for efficiency. When we don't subsidize early stage and preventive care, we end up paying much more in acute care. I mean, when people show up very, very sick, they are treated. Given that that decision has been made, that we are going to pay for care, it would be better to pay for effective, efficient care than to wait and only pay for less effective, more costly care.
So pay for actually for health care rather than for medical intervention, sort of that kind of difference.
We tend to discuss health care as one word, meaning treatment. It's two words.
Health care.
And care. And we need to improve both.
Overall, what impact do you think on kind of world healthcare delivery or healthcare treatment any reform in the U.S. is likely to have? I ask only because it is such a big country and because as other global industries, healthcare is kind of global too. What do you see that impact globally?
Healthcare is definitely global. The issues in healthcare we find around the world in terms of fragmented care, in terms of care organized around doctors rather than around solutions for patients, around a lack of measurement of outcomes. One of the interesting things, and I think this is helping to drive change, is that as medical teams measure outcomes, professionalism drives improvement. It's not about pay for performance. It's about the desire to improve results for patients. And as you measure those results, you find yourself finding ways to improve, often very rapidly. And so the more effort that goes into creating those measured results, the faster it spreads. And there are pockets of very good work going on in the U.S. There's some very impressive work going on in Sweden on teams measuring outcomes in ways that help the team to drive improvement. Not because of shopping, not because of pay for performance, but because of professionalism, because of a desire to help patients, and because when you can see what needs to improve, you can figure out ways to improve it, and it's incredibly rewarding.
Let me end by asking you sort of a forward-looking question, and I guess it has to do with chronic disease as well. Everybody's living longer. You're going to have something that you're living with, some kind of disease. How do you see that moving forward? How will the healthcare industry be able to respond, and what chronic diseases might we be looking at?
So there are several things about this. One is that people who die very old are less expensive late in life. The reason is that people who die very old tend not to have multiple chronic diseases or multiple poorly managed chronic diseases, right? So if you have multiple chronic diseases and you're managing your disease very well, you're living in chronic health rather than chronic disease, you are less expensive at the end of life. And the data on that's pretty strong. Also, when you think about, people will joke and say, well, if we really wanted to cut healthcare costs, we should pass out cigarettes to children, they would die sooner. It's false. Not only do smokers die younger, it's true they do, but they have on average 15 more years of chronic disease. That's really expensive. So as we change to an attitude of chronic health, and healthcare being about health and care, rather than just about treatment, we can improve quality of life, dignity of death, and healthcare costs.
Thank you very much,
You're
Elizabeth
welcome.
Teisberg.